As discussed in Part 1, the New York City Health Department turned their focus on zip codes with the largest concentration of Haredi or ultra-Orthodox. To that end, they convened a meeting with a newly contrived top-secret liaison group to bring change within the Hasidic community. This commission was a compilation of the who's who of those who fiercely attacked their, quote, anti-vax brethren. In a leaked video of a conference to address the Haredi community, we can see unbridled panic gripping the health department.
From at least some surveys, we haven't at least detected a sort of change around sort of hesitancy around COVID-19 vaccine spilling into routine vaccines. We have seen it for flu, but again, many of you are on the front lines, and I'd love to hear what your thoughts are about that.
Dr. Zucker? Hi, Malky.
Hi, Malky.
Hey, how are you? Not a doctor, but we have a lot of children in our program. And for the past few months, I actually at our previous health advisory meeting that we had in Yeled, I had actually put the question to Dr. Tadelbaum if he had seen a significant drop in regular pediatric vaccines. And at the time, he said he hadn't noticed any substantial change, but I had already been getting a lot of feedback from parents that I speak with because we follow the EPSCP schedule for our children to make sure they're, as up to date as possible when they come on the program. And then if they're not, we catch them up. And for about a year already, I've been speaking with a lot more moms than usual. The hesitancy has gone through the roof for regular vaccines. These are moms of families of fully vaccinated kids. Not just brand new moms, like they have 4 or 5 kids that are fully vaccinated. Now this 3-year-old and their 1-year-old or their 4-year-old and 2-year-old or whatever it is, they're like, wait, I'm very concerned now. So for the last couple of years, a lot of misinformation, a lot of fear tactics. But at the end of the day, these parents really, got a lot of information just thrown at them, and they putting the brakes on it. They're pumping the brakes big time on any vaccines whatsoever. And I talk to them as best as I can. But let's say I would have, a certain percentage of moms who were hesitant up until now. It's quadrupled. How many moms have just been, I know I did this before, but now I'm worried, and now I'm frightened, and now I don't want to.
Right. Well, thank you. I think that's really something important for us to address. And certainly with Alyssa in the health department, we've been, talking about what more, what we can do, what the right messages are, who the right messengers are. I'm really worried with, the drop in, especially MMR vaccination. So
over the last 2 years, parents have been inundated with a lot of misinformation on the COVID vaccine. There's quite a bit of subcultures of groups going, different kinds of networks going around in Borough Park in Williamsburg, and a unfortunate indirect effect is not just that Borough Park and Williamsburg have the lowest vaccination rates in the city, but now they're also dropping in their MMR. That's what it's a kind of a unfortunate indirect consequence of the first problem.
Yeah. A lot of them are just. I mean, that's what they're telling me, that they, they don't know exactly who to trust right now. They're very concerned, and until they can sort themselves out, or maybe even not even then, they're just putting pause on the whole thing. Everything, unfortunately, it became a side effect.
But how does the health department and their stealth capos intend on, quote, fixing the status quo? They came up with a breathtaking idea, a pledge to be transparent about the science and do a better job sharing the science with the population. Really? Just kidding. When's the last time any pro-vaxxer tried to win on the side of science? Never. Facts simply aren't on their side. They spent the better part of an hour talking about techniques that are successfully used in, wait for it, propaganda campaigns. Here is just a sampling of the hour-long discussion on empowering the elites with propaganda techniques.
Hi, everybody. This conversation I'm going to have really segues very nicely to the discussion that was just happening. So I'm Kristen Oliver. I'm a pediatrician and preventive medicine doc at Mount Sinai. And I also spend about 1 day a week with the Bureau of Immunization at the health department working on various vaccine projects. Here we go. So really just going to talk about using motivational interviewing to address vaccine hesitancy. And so one of the things I know Dr. Zucker said her favorite topic is COVID vaccine. I, possibly as much, if not more, love vaccines. It's sort of why I went into medicine, into pediatrics in particular. And so my vaccine glass is always half full. And going along with that, tonight I use the phrase vaccine confidence rather than vaccine hesitancy to really put more of a positive light on the conversations that we're having with patients and community members. And so, as came up in the conversation we were just having, the idea of vaccine confidence, it means basically, three things. One, people have to accept that and believe that vaccines work. They have to believe that vaccines are safe. And this most critical part, right, that they're part of a trustworthy medical system. And that involves not just the doctor, but as well as the health department, as well as the pharmaceutical companies that develop the vaccine. And that, as you all know, takes a long time to build, but you can lose that trust. Unfortunately, very quickly, and it takes a long time to build back. And so that's sort of one of the real crux in terms of thinking about different ways to have this conversation with patients. And there's a handful of different sort of techniques or tools that we're just going to go over really briefly tonight, and we can delve into them in more detail at a later date if you'd like to. And that's sort of assuming you've started with your strong recommendation, or you already know that this is a family who has some serious concerns about the vaccine in question. You follow up with these first open-ended questions. What are your concerns about getting vaccinated, right? And then the parent or family patient tells you what their concerns are. In this example, I know that getting the vaccine is going to help me, but I'm afraid. And then you just really reflect that, respond back more or less with summarizing what you think they said. In this case, it sounds like you really want to make the best choice for yourself, but you're nervous about that. And then really in the conversation, making sure you're affirming their strengths and validating their concerns. I'm really impressed at how much time you spent looking into this vaccine. It seems like you've really done a lot of research on it for people who are coming up with tons of information, even if it might be misinformation, right? It's so clear you want to make the best decision for you and your family. And then, if they come up with a specific concern, whatever it is, this sort of interesting step of asking first for permission to share the information that you have. That's something that I hear about from a lot of patients. Is it okay if I talk to you about how I think about COVID vaccine safety? Is it okay if I share with you what I know about this vaccine and fertility? Asking for permission so that you're setting up that this is not going to be a debate or an argument, and this is really just going to be a conversation. Because often, families in particular that have, may have had other conversations with providers that have been uncomfortable. And so wanting to make sure that we're really maintaining or reestablishing that trust. And then at the end, sort of summarizing what happened in that interaction.
But surely they have some other ideas up their sleeve. Of course they do.
I work with the Borough Park Jewish Community Council on their COVID disparity grant.
Right.
We're now in their third month. We're launched, we're immersed in a public health project, a public health campaign, kind of targeted around the vaccine, which is basically, as I think many people know, nobody wants to talk about it. They're like, we're done. Please don't bring it up. So we're already starting with how do you talk to people who don't want to talk about it.
Right. So David, I look forward to working with you because, I do work closely with Dr. Ige, who is sort of overseeing those grants. And we are putting, the immunization program with some of our grant funding, putting additional funding in to sort of extend grants. And we are planning to sort of have expand some of the work so that we can address sort of routine pediatric immunization as well.
I have a question for David.
Yes, please.
Hi, it's Blima. I'm just wondering, what kind of project are you working on?
Great.
Can you tell us a little bit about it?
Sure. We have about 7 different projects that we've launched with our partners at the Department of Health. who have been, really fantastic partners. Because the way I explain it is, it's basically, we're throwing spaghetti at the wall and hoping something sticks, because it's really challenging, But so there's a few things we're doing. There's going to be a Yiddish supplement for Pesach, a 4 or 5 page supplement, a health supplement that will be translated into Yiddish, and it'll have a lot of very important articles, different public health, issues, probably including MMR, and of course COVID. But we can't really make it too much about COVID because people they're not going to relate to it. But it'll have some really valuable information, and we're working with JOMA, the Jewish Women's Medical Association, on that as well. There's we're trying to launch a little demonstration pilot program in the yeshivas with a science-based curriculum for grades 5 through 8, and just test it out in the 2 weeks after the Pesach holiday ends in about 4 or 5 of the yeshivas, just to introduce a science-based curriculum that will also talk about COVID and preventive care and how to really about the underlying science of the disease for the kids, and that's going to be of course vetted by yeshiva principals. We're a very big part of the grant is that there are community health workers who people can come to them every day. They see clients all day, and they can just bring any kind of social issue to social servicey issue to it. It doesn't have to be specifically COVID related. The idea here is build trust of somebody before you can't talk about the vaccine the first time you see it. They're not going to listen. They want to hear it. You have to. The whole concept here is, how do we build trust in the community that they'll listen to? They'll even want to hear us discuss the importance of the vaccine.
Quote, throwing spaghetti at the wall and hoping some of it sticks. Is that really what he thinks of you? Subtle coaxing and going around your back by grooming the youth directly? It must be understood that David Rubel, the consultant who seeks to, quote, change behaviors of the Orthodox Jewish community, isn't even religious himself. Neither is his partner, Jalma.
JOMA stands for the Jewish Orthodox Women's Medical Association. Even though we are an Orthodox organization, all of our members are not necessarily Orthodox. We have members who come from all different walks of life. The one uniting factor is that we all are Jewish and we all are women, and we love to support the Orthodox Jewish community.
There we just had the CEO of Jalma stating that they aren't even Orthodox. They just seek to infiltrate the Orthodox. Kind of sweet, isn't it? Is this why we pay top dollar in private tuition? So the schools should accept grant money facilitated by non-religious groups targeting our kids? How do you feel knowing that there are secret active groups from the outside trying to infiltrate and bend yours and your children's perception of reality?